Good morning, Mr. Chair and Commissioners. I handed out our weekly update on our numbers. We have 830 positive cases, still at 40 deaths, so no additional deaths in Clay County. Minnesota's positive cases are 70,298 and about 1,771 deaths. Our 14-day case rate per 10,000 people, and that's what we've been using for to assist the K-12 schools in. It's just one of the data points that they're using for their reopening. And our last 14-day case rate was 8.6, so it dropped a little bit from the 9.8 or something around that. It was below 10. And now it's down to 8.6. So the superintendents all receive this data. We send that out to them. So that's something that they can use. That 0 to under 10, they do have the ability to do in person if they have all of the other things in place. They have all their safe learning, criteria. So this is just the data piece for them. So that's a good rate at least. It could change, but at least at this point it's 8.6. So that's great. We can't get, I know we talked about the positivity rates, and we just don't get all of the testing from the North Dakota Public Health Lab. So we don't have an accurate. Minnesota has the best guess of about 6% positivity rate for Clay County, but we know that's not as accurate as it should be because we just are not getting, they don't have a way to get that information to the Department of Health. So we're working with the North Dakota Department or the North Dakota Public Health Lab to see if they can get us at least some better information. So it's kind of an inaccurate number to think about our positivity rate. We just don't have the accurate number there. So we have 760 of that 830 out of isolation or technically recovered, and we have 30 active cases. I believe I talked to you last week about, we did add a few more contact tracers and case investigators. So MDH is still continuing that, and we're covering a lot of that. We had a little bit of a glitch. There was a number of cases that had wrong phone numbers, so we couldn't follow up. But we've worked with the healthcare system, so hopefully that glitch is figured out now. So we haven't had any continuing issues of being able to contact people. So that's for follow-up.
Frank, Kathy, I'm a little confused on, I noticed this before too, but so on the week of the 17th, the report for the week of August 27th showed active cases of 15. And now on the 26th, I looked back, for the report for the 24th today, the active cases for August 17th shows 26. Why does that change?
They're going back and correcting that data. They don't have the data always. There's some delays in getting that data. So we talked about how that may change. There was one time where things changed way back to April. So these numbers.
I guess when the public sees this, and I've been sharing these things
Sure.
on social media each week when I get them, because I just think the public should get to see what we get to see in as many ways as they can. Mm-hmm. And so now if I go and I post this today, the questions are going to come to me, well, last week you showed that there were 15 active cases on the week of August 17th, and now you're showing there are 26.
Yeah.
It just doesn't.
Yeah, and it's not accurate. It's as accurate as we can get to date, but it's always preliminary. So we have to remember that this is preliminary data. It's the best we can get at this time, but it will change. So active cases will change as they evaluate and get updated on the data. Not all of the suspected cases are tested, so it may not be representative of all the people in Clay County who have had a test. So it's going to change. It's ongoing. It's the best they can do with the data they get as it ever evolves and comes in.
But But it would seem to me that the data that they have at the time is the data that they have at the time, and then at the
That's right.
following week, it should be updated to the new active cases for that period of time.
And they'll
So-
go back and update it, so
So why wouldn't the 15 stay 15 and then the 30 become 30?
because sometimes it goes back even a month, or
Really?
back a couple weeks. It's just the delay in getting all of the information, and all of the follow-up on those cases. So it's kind of a revolving delay in their data, so that's the best we can get. I know that's not what the answer you wanted, but it's just, there's just a delay in each of those data sets. So whether we have, the number of positive cases may change, the active cases may change, the deaths typically do not, because that's a pretty concrete number. So, yeah, so just for the general public, this data is, it will change. It's not that it was incorrect, it's just that as they get more of that information and the state corrects the system when they're getting their final reports in, then the numbers will change as well.
Minnesota Department of Health has a little disclaimer on their data, and I can't remember the exact wording, but they're saying this is preliminary because they're cleaning it up. And part of it is, you know, do they have the right county? Do they have a confirmation of the test? And so maybe if, you know, maybe that little disclaimer is the part that's missing, is that?
Yeah, I guess it's kind of disappointing to be off by almost 100%.
Yeah, and we usually print the disclaimer on the back as well when we post it. So we always have the disclaimer listed, so we hope that the public sees that and understands this is the best data that they can provide for us, so.
Oh, there you go. There it is.
It's yeah, it's on there, so. And the only other thing is the higher ed, some of our higher ed campuses have started their classroom or remote work, and so they'll be following up with us pretty closely. We've worked with them through a process of determining if they have all their plans in place, what they're going to do if they have a positive case, who's going to follow up. So we've worked with them pretty closely, and they have direct contact in our department, so they can call us if they have questions or how to handle a particular situation. So hopefully we'll get real-time information from the colleges even before it gets to the, before we get the data. So we should hear directly from them, and we'll work through every situation they have with any cases they may have on campus. Also, the testing that happened last week at NDSU, the Dome, was open to the higher ed students and staff. We don't know how many availed themselves to that. I made sure I got all that information to the higher ed facilities. So it wasn't for K-12, but it was for higher ed. So they were able to access that if they wanted to. I know the first day they had low numbers of testing. It was about 600, I believe, is what they had the first day. We haven't heard what the subsequent days are. And we don't know how many from our side of the river availed themselves to that testing, but that was available.
I heard the numbers were low for several days.
Mr. I want to go back and ask one more question. Going back to your first part where you talked about that positivity rate for the schools use, is that 14-day rate, is that more accurate than the active case numbers that we get on these reports? Or is that also just some preliminary number?
Yeah, it should be more accurate because, of course, they're going back to look at that. It's not a projection, it's looking back at the numbers. So that should be more accurate, absolutely.
Thank you.
Yeah.
I think it just gives you a better total picture, maybe, is the best. The 1-day positivity rate. With the 14-day, we can at least see trends and
Right.
know a little more about what may be going on in the community.
Yeah, and we're seeing the trends. They went back to even starting in May, so you can kind of see.
What I'm referring to is that they go back and they change the
Oh, gotcha.
data
Yep.
on the active cases Do they have to make those same changes to the positivity rate from a week earlier?
But they are doing them in the, like this data that we have is through August 8th, so they're letting it get cleaned up before they give that total positive cases for that whole week.
So hopefully it's,
Yep.
When I
So,
take the,
Jamie?
when I take the newly reported cases and divide that by the number of tested people that day or that week, whatever, that day, I'm getting a 5.9% figure. And it's been, we've been following this now for several weeks or months, and it's been under 6% since, what, July, something like that.
yeah, and again, that's inaccurate for us, just because we don't
Sure.
have all the testing. It sounds like
Yeah.
there's a fair number of testing that goes on, family health care and through the North Dakota Department of Health Lab. So the number will be inaccurate for
Okay.
positivity rates.
So just a few, is it okay if I share some comments from the media conference yesterday, just a few of the highlights? Well, first of all, I'll talk about, they've established regional supports for the schools, so there's support teams, and in our region, Lakes Country Service Co-op has a coordinator, so that's the main contact. They have a person from the Minnesota Department of Health, 2 people that are part of that support team, and then a person from the Minnesota Department of Education. And so they're having a representative or 2 from each county. So Kathy and I are on that team, and that team is there to support the schools as they have positive cases and if they are going to transition from one plan to the next. So our welcome meeting yesterday and introductions, there were many of the school staff that participated in that yesterday. So that's kind of what's geared up and ready to support our schools as they roll out. And I'm talking about the K-12 school districts. So that was in place. 2 things that were discussed at that meeting were that each of the school districts, every employee in the school district, staff, administration, teachers, support staff will all have the availability of a saliva test to them. And so they're encouraging them to place their order basically online prior to school. They can't just test. The intent is not to randomly test as school starts, but it would be anyone who has been, who is symptomatic or anyone who is exposed, and they're asking that they do that test at day 5 to 7. And so it's a saliva test. It's very easy to do. There were a lot of questions that came up about the accuracy. There was one lab that had some problems, but the Minnesota Department of Health data is saying that it is reliable. And so that's the way that they're hoping to get results quickly and get those people isolated as quickly as they can. So that's a great support for the school systems. And then another thing they talked about, there was some data that they shared on guidance for PPE for schools, for special ed staff, and for school nurses. That was a huge priority for them as school started. And so Minnesota Department of Health put out some clear guidance on appropriate PPE or personal protective equipment needed for those students, and that helped the schools to plan for just something even like feeding students and certain treatments that they're doing, nebulizers and inhalers and those kinds of things. So
Isn't the state, well, is Lakes Country Service, they're being the distributor for a PPE equipment that the state has given the school districts too, correct?
Kathy mentioned that yesterday, but they did not bring the PPE up at the meeting yesterday, so I'm not aware of that.
I'm on that board, and that was
Okay.
what we were told. They mentioned that it's all going to go to the warehouse in Fergus Falls, and then each school district will be responsible to go there and get it.
Great. And that sounds like a good plan. I'm not surprised they would do that. The guidance, too, is there to really make sure that it's being used appropriately, because that's important, too, because the supply will be limited as well. So, but yeah.
Yeah, I think they mentioned that there was so many for each teacher and then for students.
So yeah, and then another thing I wanted to just talk about too that came up yesterday was, we've talked about the Minnesota Department of Health participating in this one of the 5 states. I still don't know what the other states are myself, but participating in the COVID vaccination. And CDC was actually on site with Minnesota yesterday, just going through what their plan is. One of the questions that came up from the press conference was whether we would get vaccine quicker, and they said no, it would be distributed nationwide once it is. But they did say that CDC was impressed with MDH's relationship with local pharmacies, and so they did anticipate that they will be using our local pharmacies to distribute that vaccine as well. So that was encouraging and helpful for us in our community as well. So that was the first I'd heard of that. Let me just see if there's anything else that came up as a part of that. They talked about the 2-dose thing, so that will be a for sure. That the priority would first be critical personnel and vulnerable populations would be their target population. From our public health perspective, we've been busy planning how we would distribute that vaccine when it comes to us. We've talked a little bit in the last couple weeks about closed pod agreements, and so we're working on those. So the first thing we would want to do is get it to anyone who's able to administer it themselves. So looking at our community partners and who has the ability to provide those injections for their staff and any residents that they would be caring for. So yeah, those were a few of the highlights from the meeting yesterday.
Okay, thank you. Any questions for Kathy?
I want to comment on the Kathy's, your department, and Amy and all of you on what you're doing for dollars too. You're putting a lot of time into there, and thank you for helping us with that.
Sure. Yep. Lots of work still to be done, so we'll continue. We'll march on.
Okay,
Okay.
stay healthy.
Thank you very much.
Thank you.